So I'm Dr. Peter Vila. I'm a double board certified facial plastic surgeon and I specialize in facelift surgery. I am the surgeon CEO of Portland Face Doctor and we're based out of Portland, Oregon. And there are basically three things that you need to understand in terms of what's going to influence your result after surgery. So number one, genetics. There are some things that are very much in my control and some things that are not, unfortunately. And so sometimes you stay really red after you get a cut or you stay really dark and that takes months and months and months to go away. That's how you're going to respond after incisions on the face too. So in general, the face heals very, very well. But if you know that you have a predisposition towards bad scarring like hypertrophic scarring or keloid scarring, that's something we sometimes have to know going into surgery. Doesn't mean you can't do it, but there are certain things that we will do like inject steroids and things like that to make sure that you get the best result that you possibly can. The second thing is surgeon technique. So this is where the type of facelift that you have is very much going to influence the result that you get afterwards in terms of the incisions specifically. Why is that? Well, when you have something called like a SMAS plication, where basically they're just tightening up the muscle under the skin, putting in some sutures to kind of bring everything up. That looks good for a little bit of time, maybe a few months, but what's going to happen is those sutures are going to fail, things are going to come back down, and the incisions are going to get stretched out and they get pulled forward. That's not a good look, and people really don't like that. And so it really comes down to choosing a surgeon who's very experienced with facelifting, specifically deep plane facelifting, because this is going to give you a much better result. Why is that? Because when you're releasing this entire plane and moving things up, you're not relying on tension for that to give you a good result, and it's just going to look better long term. It's also a much longer lasting result. So I talk a lot about this in my other videos. I'm not going to really spend too much time on this, but the type of facelift that your surgeon is doing is very much going to make a difference. And if there's any question whatsoever, ask your surgeon, and I will spend lots of time nerding out on facelift techniques with my patients specifically because I want them to understand what I'm doing while they're asleep. And then finally, incision placement is really important when it comes to getting good facelift scarring. Any surgery that is done is going to leave a scar. The question is, where is the scar placed? And sometimes you can hide the scar really well in the hairline where you just really don't see it. Sometimes it's a little more visible, sometimes it's really hard to find the scar. And it all comes down to those things as far as how long is the incision, do we go in front of the ear cartilage or behind, do you go into the hairline or along the hairline? All of those things are things that I personally have tweaked over my career as a surgeon because I know certain things work well for me. As a patient, it's hard to know where exactly the incision is going to be. You can obviously ask your surgeon, but basically looking at before and afters is going to give you the best sense of what to expect afterwards. Every surgeon should have lots of before and afters of surgical results. Maybe they're not all online because some patients just don't want their photos online. But for the most part, when you go into the office for the consultation, I, for example, will show you lots of photos of my surgical patients because those patients have given permission for me to do so. So ask your surgeon, look at before and afters. That's really how you're going to know. So let's look at some examples, shall we? There are 3 incisions that I'm going to make for a facelift. One on each side of the face and one down here under the chin. This one, a lot of us have scars from just falling and scraping our chins or whatever. This one hides great. These also hide great. The one that's probably the most visible or tends to be the most visible is the one that comes out here in front of the hairline. So that one, the reason I need to do that is because I need to get all the way out into the cheek to make sure that we are augmenting the cheek volume as well. This is not an area that patients often think about, but it does make a huge difference after a facelift to get some nice cheek volume back, just like everybody's trying to do with fillers. When you do that, it looks great, but I can't do that from back here. I do need to make that incision a little further up. When we go back along the ear, sometimes people worry about what it's going to look like here along the hairline because when your hair is up in a ponytail, are people going to be able to see it? And the short answer is, yeah, in the short term they will see it for the first month or two because it's pretty red. Over time that fades really, really nicely, and so it becomes pretty hard to find that incision even with your hair up.